everyone, and happy Tuesday. Well, we are going to be talking about balancing your hormones with the help of functional medicine. So, the main thing is Dr. Tara Scott is going to join me right now, and we are going to be talking specifically for women. What happens, when there's a hormone imbalance? What are the symptoms? There you are. Hello, Dr. Tara. How are you?
Hi, how are you?
Perfect timing today.
Yeah, so excited to connect.
Yes, yes. So I was just telling our viewers that we're going to be talking about functional medicine approach to balancing the hormones. And I was just going to introduce yourself. Maybe you can tell us a little bit about yourself, and then we can go into the questions.
Sure. I'm Tara Scott, and I'm based in Ohio. And I started out my career at OBGYN, delivering babies, doing
Yeah.
surgery, treating women. I've been in practice over 20 years, and I personally had some issues with getting pregnant and infertility. And so I had to take infertility drugs and had all kinds of problems with my hormones. So that led me to think about things a little bit differently and do more studying about hormones. So I've been doing hormone balancing for over 15 years. And, it's kind of like the more you learn, then you find
Yeah.
out the less you know. So I went on to do functional medicine training. I completed a fellowship in 2012 with the American Academy of Anti-Aging, Regenerative and Functional Medicine. I
Mhm.
became a certified menopause practitioner, and then I got
Wow.
a third board certification in integrative medicine in 2015. So I did retire from delivering babies about 4 or 5 years ago, and I no longer do that. I'm just completely focused on women's health and functional medicine and really wellness and prevention.
Wow, that's an amazing story. I mean and that's what I think your personal experience, I'm guessing, led you to becoming a functional medicine practitioner now, as opposed to OBGYN and GYN as you were doing earlier.
Absolutely. I started running all those tests on myself and trying out things. And I had
Yeah.
a history of endometriosis, and I had had 3 surgeries for that. And
Oh,
after I tried this particular approach, I don't suffer from any symptoms anymore.
wow. So that comes our first question. What were the maybe yours, if you don't mind sharing your story, and we use you as one of the case here, in the sense, like, what were the symptoms that any woman would experience when there's a hormonal imbalance?
Sure. Probably the first thing I had is as a teen, I had really painful periods. And then by the
Oh,
time I was in college, they started becoming irregular.
I
And
see.
so I was in medical school then, having extremely painful period, a lot of pelvic pain. And so I went to a gynecologist at that time. Well,
Mhm.
what do? They look at you, they say, why don't you try the birth control pill, right?
Oh my.
That's all you're offered. Even though at the time I wasn't sexually active and didn't need birth control, but that
Yeah.
was the only option that I was given.
Wow.
So I took the birth control pill, and
Yeah.
I had to try about 5 or 6 different types until I could get the bleeding regulated. And eventually it did. And it did help a little bit. I still had painful periods. I still had symptoms, but nonetheless, it wasn't as bad as
Yeah.
when I wasn't on that. So fast forward to when I was ready to have kids, I
Yeah.
went off the birth control pill because
Yeah.
when you're on a birth control pill, it is good for birth control, but
That's
not
right.
necessarily treating the cause of your
Mhm.
symptoms. It's like a band-aid. It just
Mhm.
masks it and covers them up.
Yeah.
So when it was time for me to have a child,
Mhm.
try to get pregnant, I
Mhm.
stopped the birth control pill, and
Yeah.
then my periods were farther and farther and farther apart until I wasn't having them. So they
Wow.
went back to becoming very irregular at that time. And, I was almost 30. So
Mhm.
I, took some fertility medication because at the time,
Mhm.
again, that's what I was offered, right?
Yeah. Yeah.
So I had my first daughter. And then the second time, it was even harder for me to get pregnant. I had 5 or 6 months that I took Clomid. Then I had to have surgery where they found out I had endometriosis. Then I had 5 more months of injections, no
Oh
pregnancy.
my
Then I
God.
finally had a miscarriage. Then another month of injections where I had overstimulation. and then finally in vitro. And so then I had in vitro. I did get pregnant with twins. I had a very complicated pregnancy where I had to have an emergency surgery at 5 months to sew my cervix shut, and then was at bed rest for 14 weeks and delivered them 6 weeks early. And had the first one naturally, vaginally, and the second one was an emergency C-section. So, you know, after that and having all kinds of problems with my own menstrual cycles and hormones, that led me to do, you know, more studying in, was there a better way to evaluate the cause and treat the cause instead of treating the symptoms?
Yeah. I mean, this is like a very strange, and like so many medications, so many surgeries, and so many things going on over a period of years, not just few months, right? I mean,
Yes.
and that's what I think happens to a lot of other women, probably. I'm just guessing. So what is the functional medicine approach? I mean, if you knew back then when you were 30 that there is something called functional medicine, and so you would have taken that approach rather than going into all these different things that you talked about, like the surgeries and the medications and God knows all kind of things, and IVF as well. So let's just talk a little bit about the functional medicine approach. What would have been different?
Well, you know, thankfully now people like you who are trying to educate people with social media, with the internet, women are more empowered to seek out causes themselves. So we don't know now. Our patients are more empowered now to look for this type of approach. But what I eventually found out about my own hormones is, number one, I didn't consistently ovulate or release an egg. And, you know, sometimes you don't know the reason why you're irregular. I later found out that I had Hashimoto's thyroiditis, which is an autoimmune thyroid condition. And so that, you know, needed to be treated from a functional approach. And I also have a genetic problem, a genetic alteration in my enzymes that I don't get rid of estrogen correctly. So that led me to have too much estrogen, which stimulated the growth of endometriosis. So in other words, it's as if you charge your credit card and you don't pay it off every month. What happens? You're going to have that little bit that's going to have a finance charge. And at first it's not an issue, right? But over time, you're going to have a huge debt. So that's what happens for women who don't get rid of estrogen correctly.
So I'm just thinking, like, now there was no testing, like, you know, you had thyroid, right? So the thyroid symptoms would be fatigue or anxiety or some of the things that are associated with thyroid, and then there was no testing, like, you know.
So when I was going through my infertility workup, the endocrinologist, the reproductive endocrinologist, did check my thyroid. That was in between the pregnancies, and they did start, but again, once they found out that I had Hashimoto's, they didn't look for the cause, which now in functional medicine, we definitely look in the gut. And a lot of times it's tied to abnormal bacterial overgrowth in the gut, provoking autoimmune pathogens. And so there's a huge gut thyroid connection. So at the time, you know, I didn't know that. And so they found out that I had an underactive thyroid, and they just gave me Synthroid, which is commercially available, you know, thyroid, you know, and now I know that I have a non-celiac gluten sensitivity because of the Hashimoto's. And so Synthroid actually has gluten in it. So it's kind of like a vicious circle that the traditional therapies help a little bit, but then also cause other problems.
So now, like, fast forward, here we are, you know, I think not everyone in America knows about functional medicine, or, you know, these are options, but that's what we are trying to do, you and me together, you know. So what would be the first thing, like, if someone would come to you and have some kind of a symptom? So they probably come to you with some symptoms. Oh, I'm fatigued, or I'm anxiety, or something like that. So that would be a testing. You'll walk them through some kind of a test and then kind of figure out what to do.
Yeah, so most of the time, just because my background is an OBGYN, most women come with either a problem with their periods, painful periods, irregular periods, or weight gain, or fatigue. Those are the common ones. Now, to test thyroid, it's just regular blood test. But most of the traditional practitioners only check for TSH. And TSH is a pituitary hormone.
Yeah.
And that does reflect what your thyroid makes, T4, but your body has to convert it to T3 in the active form. And very few practitioners actually check that. Very few practitioners actually check the thyroid antibodies. So it'd be as if your T4 was your paycheck. You can't walk into Whole Foods and take your paycheck. You have to cash it, right? So cashing it is your body changing T4 into T3.
Okay.
And then that's the active form. And those ratios of your T4 and T3 are very important for energy, for your menstrual cycles. So that's one difference that in functional medicine we do. We take a more holistic approach. So we don't necessarily do that different testing. It's the same traditional blood testing. We might order a few different things. When we're talking about treating female complaints that are due to the menstrual cycle, there's several types of testing that we do. And in somebody who is still having a menstrual cycle, we will start with the traditional blood testing, but you have to tell the patient specifically when to get the testing done. So if it's somebody who is having a lot of problems that, like I had with painful periods and pelvic pain, we most likely try to check the labs 3 weeks after your period starts. So we want to check it after ovulation because it's generally due to an imbalance between estrogen and progesterone. And progesterone's not produced until you ovulate. So estrogen is produced by the developing egg. At ovulation, progesterone starts to be produced. So those two have to be in a good ratio in order for your hormones to be in balance. So we will start with traditional blood testing in females, but we'll tell them a very specific time and day, depending on when their period is, to get it done. Once we get those testing back, often it's followed up by other types of testing. We do salivary testing and we do dried urine, and we also do something called blood spot testing. So if I could discuss the differences between the testing, you want to know what you're looking for and why you're doing each type of testing. So it's the year of the census. If you're a census taker and you come to my house right now, you would see my husband and I in the living room and you'd say 2 people live here. But that wouldn't be accurate because my daughter's upstairs, my son's in the basement, and I have one away at college. So that's not accurate. You're only looking at one room of the house. So blood is only one compartment of the body. And it's really good to look for thyroid hormones because those are large peptide hormones. It's good to look at the brain hormones. It's good to look at cholesterol, your blood glucose, your magnesium, potassium, those kind of things. But hormones are attached to a protein, and nothing is happening with hormones in the blood. They're just carried and transported from one gland to another. So blood isn't a great place to look for hormones unless we're specifically looking at a certain time. So the next thing that happens is these hormones that are attached very tightly to a hormone binding globulin, we call it, it's released in the tissue. So the thought is once it gets to the skin, to, you know, the hair, the uterus, it's going to be free. So years ago it was discovered that when you spit into a tube in the saliva, the hormones are actually released from the binding proteins and they're free, and it correlates fairly well with your tissue levels. So one of the main problems that women have when they have either with reproduction or just hormone issues is we normally have 3 types of estrogen, and they have an abnormal ratio of what's called the bad estrogen. So you've got estradiol that's made in the ovary, and you've got estrone that is made in your muscle and fat, and it's converted. That conversion doesn't happen in the blood, it happens in the tissue. So we need to know if you have a lot of estrone, it's going to foster development in the breast, uterus, and potentially increase your risk of cancers, those type of cancers. And it also will cause weight gain, breast tenderness, you know, water retention, a lot of those symptoms that we see. Since that conversion happens not in the blood, but in the tissue, we would need to do something like saliva testing to do that. It'd be like if my daughter, who's 19, left the house and said, I'm going to go to the library on Friday night, and she was dressed in sweats. And I thought, what a good kid. She's studying on Friday night. But then she went to her friend's house and changed into a tank top and a mini skirt, and then she went to the bars.
Yeah.
I'm never going to see that. I'm not going to see her change because she's
Yeah.
outside of the house, right? So we
Yeah.
got to detect that in certain situations, like endometriosis, like fibroids, okay?
Mm-hmm.
The next type of testing that we do very frequently is a dried urine test. So it's a dried urine test of complete hormones, DUTCH or Dutch test.
Mm-hmm.
Just come on the scene last 5 years or so. It's a
Mm-hmm.
great test. So basically what that's looking at is the way your body breaks down hormones. And it's also looking at your cortisol. It's looking at your, what we call androgens, which is testosterone and DHEA, and looking at how you break down estrogen.
Mm-hmm.
So that would be like, it's tax time, it's end of the year. If my
Yeah.
accountant is trying to prepare my taxes and I just say, here's my bank account, here's my savings account balance, that tells him nothing, right? He needs my
Mm-hmm.
receipts. He needs to
Yeah.
see how much did you spend on payroll? How much did you spend on rent? How much did you spend on marketing? So looking at all these different things is what we look at in the urine testing.
Got
So
it.
that is key for somebody who has problems with estrogen balance to looking at how they break down the estrogen metabolites. And we've also discovered ways that just through dietary changes, through supplements, and sometimes prescriptions, we can manipulate and balance those things.
So it's dietary change, supplements, and also exercise as well.
So yes, lifestyle changes,
Yeah.
dietary changes, supplements, and some women, they need some prescriptions to balance things out, natural hormone prescriptions.
Got it, got it. So let's talk a little bit to the menopause part. So we've been talking about the, like the younger women right now, with the periods and all. So what happens, when the women is perimenopause and the menopause, that also we hear a lot about the hormonal imbalance, so is that different type of hormonal imbalance that's happening when a woman is a little bit older versus she's younger?
Well, I'm seeing these hormone imbalances earlier and earlier. And yesterday in the office, I saw an 18-year-old who's having estrogen dominance. So there's so much estrogen in our environment, in our food, in plastics, that we are seeing women earlier with estrogen dominance is what we call it. But in perimenopause, the predominant hormone abnormality is estrogen dominance because you've got these eggs, they're not as good quality, so they don't produce as much progesterone. But because the brain is trying to really get these eggs, these old eggs, to release, the FSH increases, so estrogen increases, but the follicle is not a good quality, so progesterone decreases. So then you have that discrepancy. And women very frequently will have periods sometimes closer together, sometimes further apart, heavier, lighter, all kinds of changes. But the most common complaints that I see in perimenopause are weight gain and fatigue.
Mm-hmm. And the menopause is also the same part, like the weight gain and fatigue, and sometimes they have hot flashes. All those things are going on at the same time.
A lot of the symptoms do overlap. Menopause is defined as 1 year without a period. So until you have 1 year without a period, and the average age is 52, you're not menopausal. You're going through the menopause transition. And so the problem with menopause these days is there's still the stigma of hormone therapy, right? So yes, we work with patients holistically. We always talk to them about diet, about what they eat when. We always talk to them about their sleep, about their exercise, about their stress management. That goes without saying. And also whether or not they're taking any kind of nutritional supplements. But as far as menopause goes, some women are able to get through menopause without any problems. Some women have a lot of problems and they're unbalanced in their hormones, and they're going to be at risk for other medical problems down the road if they don't balance them out, right? And then some women just have very, very low hormones and they're miserable. So about 18 years ago, there was a study that was called the WHI, and it was done to say, hey, we're seeing all these great effects of given hormone therapy. And at the time, predominantly what was used was Premarin and Provera, which was made from horse urine. So horse urine, a synthetic estrogen, and a synthetic progestin. So not what we're taking, it was synthetic.
Yeah.
And so in this study, they said, wow, estrogen helps your bones and helps your heart. Maybe everyone should take estrogen. So they set out to do a study in women who were 65, average age, and they took it for 5 years, and they found an increased risk of blood clots and an increased risk of breast cancer.
Oh my God.
So everyone panicked. And to
Yeah.
this day, everyone still remembers that study and thinks, you know, there are only 16,000 women in it, and they think, oh my gosh, hormone therapy is terrible.
Yeah.
But since then, there have been several great studies that have looked at this and have not gotten the same media attention. One of them which looked at all different types of estrogen and said, would it make a difference if we gave estrogen through the skin and not as a pill? And
Okay.
so, you know, all 17 studies agreed that you would not have an increased risk of blood clots if you took estrogen through the skin, either as a patch or a gel or a cream. So that eliminates the blood clot issue. We never prescribe estrogen orally. And these prescriptions that are through the skin are bioidentical, which means it's chemically the same structurally as what our body makes. So it's kind of like financial aid. You know, some people go to college, they never will get financial aid. You know, they won't qualify. But
Yeah.
some people will get a lot of financial aid because they need it to make tuition. That's like hormones. Some people don't need hormones. Some
Yeah.
people do need it. And those people that need it need to be given only the amount they need. They need to be monitored correctly. And so there was another study that was done in Europe about 12 years ago that looked at bioidentical estrogen through the skin and oral progesterone. And they found that there was no increased risk in women 40 to 64 when they took hormone therapy, this bioidentical hormone therapy, compared with women who didn't take hormones. So it's really important to know that there are studies out there, but there's still a fear. When the number one killer in women is heart disease, number 2 is stroke, number 3 is lung cancer, number 4 is breast cancer. And if you add up 2, 3, and 4, you still don't equal the number of deaths from heart disease. And by and far, estrogen protects the heart and the brain. So much more studies now that are coming out that are saying there's less cognitive decline with hormone therapy and a 19% reduction in diabetes. So you got to look at the whole picture.
Yeah, yeah. But the thing is, you know, there was such a bad connotation with the hormone therapy. And, you know, I mean, I'm not a doctor, but, you know, most of us, like average user here, oh, don't take hormone therapy. It's like, oh my God. So that's the problem.
That's the problem. And that connotation exists among patients still, patients our age, but also still doctors. They don't understand the difference. I mean, it's kind of like this. If you had a diabetic and their blood sugar was very low and they're about to pass out, would you give them Splenda?
That's right. Yeah.
No, you wouldn't give them Splenda. Splenda's an artificial sweetener. You'd give them glucose. It doesn't do the same thing in the body. That's just like hormones, synthetic hormones, and bioidentical. There's different risks, there's different actions, and there's different side effects.
Got it. Got it. No, I think this is very useful. Someone had a question about something. I think we were just going through it. If you want to ask the question again, if you don't mind, I think someone asked a question and we were, you know, still talking. So you're welcome to ask that question again. Okay, so let's see on the functional medicine. So what would be a daily, a very typical, a daily day for someone who has a hormonal imbalance, and what you would recommend from a diet, lifestyle, and you know, perspective?
Well, think about the year we've had. What we're seeing now is so many people with stress, right?
Yeah. Yeah.
I mean, the world is strange. We've had this crazy pandemic. People's jobs have changed. Either they're in financial stress or they're working from home. They want to be home. They don't want to be home. Their kids are home. You know, it's just so much stress. And your body and your stress system is not designed for chronic daily stress. It's designed for fight or flight, life or death stress, and then no stress. So stress affects your hormones in the sense that it starts to make your thyroid not be able to do that conversion between T4 and T3. It definitely affects the way your body gets rid of estrogen, and it also depletes your androgen hormones, testosterone and DHEA. So stress alone can cause anxiety, fatigue, problem sleeping, weight gain. So we're seeing a lot of that normal. So when you ask about the typical day, as far as patients, most people who have an adrenal issue are very tired in the morning. They don't have restorative sleep. So what do? They drink coffee, and then they feel a little bit better. Then they eat lunch, and then they crash at 2, 3 o'clock. They're either reaching for sugar or they're reaching for another cup of coffee. And then they usually feel okay in the evening. And then when it's time to go to bed, they're tired, but then they're wired and they can't fall asleep.
Hmm.
So that's a typical day. So what we work with people on is we talk about a lot of things. For every patient, we take a very detailed history, and then
Yeah.
we talk to them about, their sleep hygiene, right? And so
Hmm.
some basic things.
Yeah.
Don't keep your phone in your bedroom, that should
Yeah.
not be. Screens, blue light blockers. I should probably have my blue light blockers on right now. And so turning off the screens in the
Hmm.
evening, and some
Hmm.
people say it should mimic the sun. I mean, now we're at the time where it gets dark so early, it might
Yeah.
not be possible to do that.
Yeah.
So we definitely talk to them about sleep hygiene. The body needs 7 to 8 hours to restore and sleep. And so if they're not sleeping, sometimes it's because they don't have enough progesterone, they don't have enough estrogen. So we work with them on that. And it could be also cortisol. So
Okay.
we want to make sure people have an overnight fast of at least 12 hours every day. Now, if you're a female and you're trying
Hmm.
to lose some weight, sometimes we'll widen that window a couple times a week, not
Hmm.
every day, to 14 or 15 hours. But
Yeah.
it's really important for you to have at least that 12-hour overnight fast, because systems need to shut down, things need to
Hmm.
be metabolized, and you shouldn't be eating late at night.
Hmm.
So then we talk to them about movement too.
Yeah.
Now a lot of our patients are virtual, so we're sitting a lot more. So I got a standing desk with a treadmill,
Hmm.
get out. I mean, you live somewhere warm, I think, because you're on the Pacific Coast, but
Yeah.
I'm not somewhere warm right now. We got about 7 inches of snow today.
Wow.
And so, movement's really important, and it doesn't have
Hmm.
to be running 10 miles. It's just got to be getting your steps in, and not sitting is the new smoking. So we talk to them about that. Most women, when they have hormonal issues, are very carb sensitive. So we talk to them about the first thing that they eat in the morning. We like to have some kind of fat in there or protein, but not usually breaking your fast with the carb. So
Hmm.
we'll go through things like that, as well as whatever they need as far as a supplement regimen. When we find out their hormone picture and their hormone balance, and
Hmm.
if we can help their estrogen detoxification, then we'll give them some supplements for that, and kind of depending on what their problems and complaints are.
So detoxification through the supplements that or through food, like a lot of a lot of other medical systems will say, okay, you take a juice, 3-day juice cleanse or some kind of a khichdi cleanse, like Ayurveda talks about that. So
Yeah.
or herbs, so it's functional medicine. What kind of
We do all kinds of detoxes, from a medical food detox to a whole food,
okay,
plant-based talks. But right now we're doing, in our private Facebook group, we're doing what we call a beat the bloat detox that we always do after Thanksgiving, just 5 days,
okay.
where, day 1 you eliminate gluten, day 2 you eliminate dairy, day
Mhm.
3 you eliminate sugar, day 4 processed foods and grains. And so it's just a quick 5-day kind of reset that we like to do between Thanksgiving and Christmas, because the holiday season usually has a lot of sugar.
Got it, got it. Now, I think this is very helpful. I see a lot of people joining in, and if you have any questions, you're welcome to ask questions or feedback. I did see a question, but I think by the time someone else joined, and I didn't get a chance to read the question fully, so I'm sorry. But if there are any questions and comments, you're welcome to put them in the chat window right here. Anything else you would like to? Oh, yes, the one thing I would say. So let's say, from using functional medicine, someone has a hormonal imbalance. How much time do you think it will take for, a woman to get back in balance, assuming that now she's using the functional medicine approach as opposed to taking all the medications we were talking about earlier?
That's a really great question. And some of it depends on how old the patient is, right? So if
Okay.
they're in their late 40s, things are very irregular, and we can't stop that. They're going to be irregular until period stops.
Yeah.
If you're in your 30s, and lately I've been seeing a lot of women in their 30s, and I'm so glad they're
Hmm.
trying to get to the bottom of the problem now when
Yeah.
they're 30, instead of waiting till a problem.
Yeah.
So, after we do testing, it takes a couple cycles to see, 2 to 3 months to
Okay.
see what are the therapies doing. And then we reevaluate, possibly retest. Maybe we just kind of connect and see What are the symptoms? Are the symptoms any better? So really, we don't really have a set protocol because it's different for every person. It's personalized. So, but I think that if you're a younger patient and you're more regular, you might see results a little quicker than if you're older and things are constantly changing. It's like a moving target. You 1 month you might have high estrogen, the next month low estrogen. So it's going to be a little irregular until you actually go through menopause. So, but that's a really great question. How long to some women get, they see results like within a week with some of the therapies that we give them. And especially if it's a cortisol issue. And then again, the thing is, if you're somebody who's dealing with a stress related issue, how much control do we have over our stress right now? So it's mainly, we're trying to kind of manage stress and build the tools that, because it keeps coming, to be able to help it.
Yeah. Someone had a question about the PCOS and getting pregnant. If you wanted to comment on that.
Yeah, so PCOS, the diagnosis of PCOS is more of a syndrome. And so we don't really know what the cause is. There's 3 theories. One theory is that for some reason the brain releases an abnormal ratio of FSH and LH, which are the stimulatory hormones, and that causes anovulation. The second theory is that you have high androgens, and that's because you have high testosterone and high DHEA, and that's the reason that you don't have ovulation. And the third theory is that the root cause is high insulin, and insulin decreases your ovulation, increases your testosterone. So one of those 3 is the cause. The hallmark is anovulatory cycle and high androgens. That's the diagnosis that you need to be diagnosed with PCOS. So for PCOS, basically we support the patient because they're generally having too much estrogen, not enough progesterone, and too much testosterone. So working on insulin is very important with those patients. That's a huge dietary change. Sometimes we do have them take supplements like inositol. Inositol is a great one for PCOS, myoinositol. And just putting them more on a low carb, and some intermittent fasting also would be great for patients. Sometimes they might need supplements to help decrease or block testosterone. So we may need that if they have a lot of symptoms with high testosterone. Now, as far as fertility goes in the PCOS patients, we work on the insulin resistance and the estrogen dominance, and some of our patients just conceive naturally. Now, if you're not someone that ovulates, you might have to have something to help you ovulate. So it just depends.
Okay. So it depends on cleansing the system or, what we talked about earlier, right?
Right. For sure. We try to look at those, the estrogen detoxification to make sure that's not an issue. And we look at the hormones and we try to maximize things. And treat things naturally, because when you have PCOS, you're basically given 3 options. One, if you want to get pregnant, take fertility drugs. 2, well, actually 2 options. 2, if you don't want to get pregnant, then take birth control pills. So some people don't want to do, some people don't want to do either. So they might want to take a functional approach, which is what we do. We identify hormone abnormalities. We work with a holistic, addressing the hormone abnormalities, the insulin resistance, the high androgens, and the estrogen dominance.
Got it. Well, any other questions, anyone, or any feedback? If you can't think of any questions right now, you're welcome to send us in the feedback, and we'd be happy to, put it in the comment. Any other thing you would like to add? This is very informational.
Yeah, the biggest thing that I kind of message I want to get out there is really knowing your hormones. I'm not advocating, yes, you have to take it, no, you shouldn't take it, but everybody should know what their hormones are and if they're imbalanced or balanced, right? Because if you know that you have a predisposition to have high estrogen and not get rid of estrogen, then you know that you have an increased risk of breast cancer and uterine cancer. And we need to be more preventative about breast cancer. Everything right now is aimed at early detection, not prevention. So that's a huge thing that I feel like we could be doing a better job. My patients that have endometriosis, who have uterine fibroids, heavy bleeding, any estrogen pathology, you're going to be potentially at risk for increased breast cancer risk. So if I had a wish that everyone could find out, like, you know, at 25 what their hormones were, at 35, at
Yeah.
45, so they knew that they were imbalanced. You know, you know,
Yeah.
just like for kids we do those well checks. You know, could we start having women advocate and saying, you know what, I'm
Mm-hmm.
going to get my hormones checked and see. I would love
Mm-hmm.
for more people to come in and tell them, you know what, you're doing pretty good. You're doing pretty good with your eating. You're doing great with your lifestyle,
Yeah.
and your gut looks good and your hormones look good. That would be great. But I realize the resources, not everybody has the
Mm-hmm.
resources, and some of the testing is not covered. So that becomes a little bit of a challenge.
No, I love the way you said the wellness check, because you know how we do it with the kids, like we have intervals. So I think we should do it not only for women, even for everyone, right? When we grow up, we just
Totally agree.
we just don't do it. We stop doing it, and suddenly, boom, something happens. So maybe there's some kind of a regular testing that all of us can do, and then also talk to a functional medicine doctor, at least once a year, or some kind of a check-in to make sure that our machinery is functioning properly.
Yeah, you know, I think, you know, like I said, a properly trained hormone specialist can use the
That's it.
routine blood testing. I mean,
Okay.
we can. Some of the
Yeah.
other testing may be, you know, if it's a budgetary issue, and of course, stool testing sometimes covered, sometimes not, depending on the diagnosis. But you
Yeah.
know, some people think everyone should have a stool test. What happens when you take your dog to the veterinarian? The first thing they do is they want a stool sample. That's how they
Hmm.
tell if the dog's doing okay, right?
Yeah. Yeah.
So you know, again, I've been doing this for 15 years, and I
Yeah.
think I'm so happy to see things like this, Instagram, Facebook,
Hmm.
people like you trying to educate people to get the word out there. And it is
Yeah.
helping people to at
Yeah.
least have the resources to be able to help themselves.
Absolutely, absolutely. I mean, I think this is the way of the future. Like I said, I'm not a medical doctor. I'm just a user. I also have a similar story to yours, but this is the future of the medicine, functional medicine, natural medicine. That is the future. And that's why we are trying to propagate so much by inviting people as experts like yourself to come and tell us the science behind it, the research behind it, the logic behind it, so people understand. And that's all we are trying to do. So thank you so much. I really appreciate you joining us today, this afternoon. To all our viewers, let us know how we are doing and what kind of other topics you'd like to see. We just want to show you, bring you experts who will tell you, who will educate you why you should go for functional medicine and natural medicine as opposed to taking a pill. That's really what we're trying to do. Any last comments from you, Dr. Scott, before I wrap up today?
I just have a lot of free education on my Facebook page, Revitalize
Yeah.
Med, on my Instagram, Revitalize Med. I have a YouTube channel, Tara Scott, with a lot
Okay.
of videos. I have a free webinar about a functional approach to
Wow.
women's health that's on my
Okay.
website, revitalizemed.com.
Mhm.
And we just launched a hormone course. So if you don't have a functional medicine doctor in your area, it's kind of an online, on-demand DIY course where you can kind of go through it and see how you can help yourself, or maybe empower yourself to know what questions you can ask what doctors. And you can find all that on our website, revitalizemed.com. So, you know, one of my passions is, you know, educating patients.
Mhm.
I've been teaching doctors how to do this for 10 years. I've actually
Wow.
taught in 5 continents, you know, other doctors how to do this type of
Yeah.
medicine.
Mhm.
So if there's any way, you know, obviously some
Mhm.
people, you know, either geographically can't see a functional medicine doctor or economically can't, but they were motivated to make some of the changes, but they just
Mhm.
need some guidance. So that's why we keep putting a lot of free content out
Yeah.
there. The hormone course has a nominal fee, but, you know, a lot of the other things then are free for anyone who wants to watch.
And we'll love to make it available to our viewers, so maybe we'll connect with you after our session, how we can do that, to other viewers as well. And that's what we've been trying to do, is put out a lot of free information. These interviews and all these educational videos are all free, for the viewers to watch and learn, how they can improve their health. So thank you so much for being with us. And anything else that I'm just going to wrap up right now?
No, thank you for what you're doing, for your dedication to trying to educate patients as well and give them some tools to search for the information. I appreciate that.
Absolutely. Well, thank you so much and have a great evening to all our viewers. Keep watching, keep telling us what we are doing and give us the feedback, and don't forget to share. Thank you so much. With that, calling it. Bye-bye.